Well, good morning to everyone, and thank you all for allowing me to share a few minutes with you and share my experience of the 2010 mission project. Um, one key phrase that I think I really am going to take home from this is what Marty mentioned, was the coin phrase, this medical education gauntlet. It really was an innovative part of this program, not just to take care of the people for that day, but to look at these people for their care for the future. And when I first heard that gauntlet term, I thought, what came to mind to me was some medieval rite of passage. These patients were going to have to run out of the convention center fearing for their lives while we pelted them with information that they didn't want to have. But I want to make sure the record is straight, that no patients were harmed during the development of the medical gauntlet, and we all came out, and it actually wasn't anything like that. It was a really nice experience. There were a lot of friendly faces, and I think really most of the patients were very receptive and really weren't expecting to have as much care as they really got. It was an added bonus, I thought, and it really was the icing on the cake for this program. As one of the medical directors, one of the things just from the start I thought was going to be a big challenge, and the key to the success was going to be making sure we had providers to cover all the demand we were going to have. And I was just so impressed with how well Melanie and her staff were able to collaborate with so many great people, so many great resources. Dr. Lutz was so great, bringing everyone together. The collaboration was just so incredible that we were able to have a great amount of physician support, nurse practitioner support, medical support, nurse support, non-medical support. And the other key I thought was going to be very important is once we get these volunteers, to make sure we make the most use of their time. And I really think that worked out really well. Aside from an hour or two when we were first ironing out the kinks of getting the flow separated from triaging these folks from dentistry, vision, and medical care. Once we got that figured out, I think the flow was tremendous. It wasn't too much. Everybody had a good experience, but I think that we got the most out of all the resources we had, and certainly we had plenty of hands, and certainly everyone that I talked to was very impressed with how many resources they had available, actually more than they actually had in their normal day-to-day functioning clinics or hospitals that they worked in. So I was really tickled in how well that went. We did have a few challenges, however, working with medicine, dentistry, and optometry all in one day. For instance, imagine trying to take a history from a gentleman who just had 4 teeth pulled and still has his whole entire face numb. Didn't quite go as quickly as one would hope. But we managed pretty well, I think. On the flip side, we had people coming from the vision folks who had just had their eyes dilated. I was able to see some retinas I haven't seen since medical school. So that was a nice bonus. So the prevailing feeling I had was just such the infectious, positive attitude from not just the patients, but all the volunteers, that it was really hard to avoid if you were in the building. And I really implore anyone that has any kind of burnout feelings as far as what are we doing in medicine, please come and volunteer. Just come experience some of these events. I don't think I really appreciated the scope of what we were developing and all the planning that had gone into this until we actually started talking to patients, until we started actually listening to these patients, hearing their stories. And after the first day, Marty and I were able to reflect on some of the incredible stories that we just seen in that day. You know, for instance, just one patient that came to mind was a middle-aged, lovely woman who was diabetic, hypertensive, had simply not been able to afford her medicines for several months, had not been able to get to a regular health care system, just simply couldn't afford it. She came in, was having some atypical chest pains. She was able to come into our system, get her blood checked, screened for sugar, get her urine checked, see a provider. On site, she was able to be referred to a cardiologist that we had working with us, get an EKG, be reassured that her chest pain was non-cardiac. She was able to get her medicines prescribed, and while she was getting those prescriptions filled, she was gently escorted to our medical gauntlet of resources. She was able to get nutrition information for her conditions. She was able to set up care for her follow-up with the institution in her county. All of this within a matter of hours. And we sat back and we thought about this. Where can you get this type of care? What a great system this is. This is a system that really reminds us of what we keep reading about and what we're developing across the country in so many health plans and so many corporate plans. In light of the new healthcare reform, to this emphasis, in our small way, we were able to give integrative, patient-centered care with an emphasis on developing medical homes for these people. So I think we've got a lot of, even though this wasn't the real world situation, we have a lot of things we can develop from this. And even though I think we gave a lot of great benefits in just the 2 days we saw these patients, I hope we've given a lot more benefits to the whole upstate and the whole state. And I really think we already have, and the reasons why I think so are, one, some of the medical clinics in the upstate have already known that we've seen a significant increase in their numbers of patients and access to their resources. They've actually even not just had increase in patient numbers, but they've had increase in their number of volunteers that have volunteered for their clinics. We've already been asked to be consultants for a clinic that is going to be run in Anderson that's going to be a smaller scale to do the same type of idea, and so for some of the providers there that came and visited with us on site to see how things were working. So that's just a few ways, but I think the biggest way is how we all were able to know how each other were working together to collaborate, and not just the patients being able to figure out where the resources were, but all of the 500 volunteer providers are going to know where a lot of these resources are now. And I think that's just going to trickle down, hopefully, to their families, their friends, their patients. And we'll be able to continue to use the resources that are already out there, just having people getting access to them. So again, I really want to thank everyone for letting me talk and allow me to participate in this. It was really a great experience for me, and I think I have to say that I probably benefited more than any specific patient.